Hi, I'm Dr. Gorman. I wanted to talk today a little bit about the problem we have in traditional medicine with people being specialists, or what we call the over-specialization of medicine. So what I mean by that is everybody that you go to your family doctor, they've got a specialist for everything under the sun. And the logic makes sense where you would want to go to somebody that's an expert. And the definition of a specialist is someone that knows more and more about less and less, right? So what I mean by that is if you're a knee specialist, you're an orthopedic person, but all you do is specialize in knees, then over time you really don't know much about the whole big picture. You don't know, what if the knee problem's coming from the hip, or what if it's coming from the foot? Or what if the knee, in acupuncture, the knee relates to the gallbladder? Well, what if that is, well, in chiropractic, a lot of knee problems come from the sciatic nerve and the low back. Well, what if they're not looking at any of those things from a big holistic perspective? They have what I call the blinders effect, right? It's like putting blinders on and the doctor says, I don't care about anything, I'm an expert in knees. Part of the problem with that is then they end up saying, all these other things that I just mentioned as a few examples, they say, well, I never heard of that. So since I'm a knee expert, and how could I be a knee expert and never have heard of that? So therefore, they think they must discount all these other relationships, right, that exist, whether it be in chiropractic, in acupuncture, in nutrition, in homeopathy, and et cetera, et cetera. So part of the problem with specialists too is specialists are really, really good, and we need them for things like surgery and for things like very serious. When people have something that's very, very serious, it's like life-threatening, right? We obviously want a specialist that just focuses on that because they have a much better chance of saving that person's life. Let's be real though, that's like less than 0.1% of the time that you go to a doctor that's actually the case. So specialists might be good, for example, if you have to get knee surgery because you actually injured your ligament in your knee or your meniscus in your knee. You don't want to go to somebody that dabbles in that. You want to go to somebody that all they do all day long is knee surgery, right? So they're an expert in that. But here's one of the very important points. You don't necessarily want to go to the specialist of any kind to determine if you need surgery. In other words, I have many patients that come in and say, well, I have pain here, and they did an ultrasound and they said it's my gallbladder. And I said, I have gallstones. So I went to the gallbladder surgeon and asked him, and they said, sure, we have to get your gallbladder out. Well, again, that's like going to the butcher and saying, I'm surprised that they recommended meat, right? It's like, no, all they do all day long is general surgery and surgery for the gallbladder. So they say, sure, we could take that out, that's no problem. You don't need that organ, right? Now, there's a time and a place where that's an emergency and it's very serious, and we're very grateful to have them for that. But don't go to a spine surgeon to find out if you need spine surgery, right? Go to 3 physical therapists, 3 chiropractors, 3 surgeons, and a couple other people and get all kinds of tests and opinions. When you decide that you do need that particular surgery, then go to interview 3 different surgeons and figure out which one would be the best that you feel the most comfortable with for that surgery. But going back to the beginning, the problem with specialization is we're too focused on whatever that particular specialty is, and we're not able to see the big picture. So we need both. We need specialists and we need family doctors, more general, but we also need holistic practitioners and to be able to look into all of that kind of stuff. Thank you.